Hello, I'm Richard Stewart, and welcome to Cleveland Health on TV20. This is a show where we dive into the health topics that matter most to our Cleveland community. In each episode, we'll bring you important insights, expert advice, and local resources to help tackle critical health challenges we all face together. So stick with us as we work toward building a healthier, stronger Cleveland, one conversation at a time. Today on Cleveland Health, we're discussing a topic that affects millions of Americans: heart health. Heart disease remains the leading cause of death among seniors, but knowledge and prevention can make all the difference in the world. Today, we'll break down key statistics on heart health for older adults, highlighting the risk factors, warning signs, and steps you can take that ultimately save lives. We'll also be joined by Mary McNamara. She's Director of Aging for the City of Cleveland, to discuss local resources available to senior citizens. Plus, we'll hear from Dr. Thomas O'Neill, a leading cardiologist at University Hospital's Harrington Heart and Vascular Institute. He's going to share expert advice on keeping your heart strong at any age. We also have an incredible story of survival: a heart patient whose health has been restored after suffering a life-threatening heart attack. You won't want to miss it. But first, we begin with Nicole Ward, who's here to talk about the Make Them Know Your Name Foundation, an organization working to raise awareness about heart health and empowering folks to take action. Nicole Ward has transformed personal tragedy into a life-saving mission. Following the sudden passing of her husband, Paul Ward Jr., from cardiac arrest, Nicole and her son, Cleveland Browns All-Pro cornerback Denzel Ward, founded the Make Them Know Your Name Foundation. It's an organization dedicated to raising awareness about heart health and increasing access to automated external defibrillator machines, or AEDs. Paul's sudden passing underscored the critical need for immediate access to AEDs and proper health education. Many people, including athletes and even otherwise healthy adults, suffer from undiagnosed heart conditions. The Make Them Know Your Name Foundation is named after Paul's philosophy of leaving a lasting impact on others. They're committed to equipping schools, gyms, workplaces, public spaces, and underserved communities with AEDs, and also educating communities on how to use them. Nicole has also worked to ensure that more people have CPR training in case of emergencies. She emphasizes that having the right tools available can make the difference between life and death. Through partnerships with healthcare professionals and policymakers, she's been a vocal advocate for making heart health a priority, both locally and nationally. Ward also uses her platform to educate others about the importance of heart screenings and preventative care. She regularly shares her personal journey at conferences, schools, and community events. Her hope is that her story will encourage others to take proactive steps in monitoring their heart health. Through advocacy, education, and community outreach, Ward and her foundation has made it their mission to ensure that others are better prepared to respond to cardiac emergencies. We're now joined by Nicole Ward. She's Executive Director of the Make Them Know Your Name Foundation. Nicole, thanks so much for joining us today.
Thank you for having me.
So it was nearly 9 years ago your husband passed away so suddenly. Explain to us how the Make Them Know Your Name Foundation has served as a healing catalyst for you and your family.
Yeah, it was May 2nd, 2016 when he passed away. And as you can probably imagine, it was a very difficult time, very unexpected, and very hard because, you know, he was my high school sweetheart. We had been together for a very long time. And so to lose someone like that very unexpectedly can be very hard. As a result of what happened, in doing some research and education and learning more about heart health, my son and our family decided to start the Make Them Know Your Name Heart Health Foundation. And it has been helpful in the healing process because everyone grieves differently. You never know how you're going to grieve. For me, I know that one of the things that I tried to do was to keep myself busy. But when my son had an opportunity to start the foundation, I also found that to be and a way to heal and to grieve as well, because it allowed us to be able to potentially help others to avoid a situation that we learned was preventable, and so that they wouldn't have to face what we had faced as a family.
Speaking of helping others, we heard a little bit about some of the initiatives you're involved in through your foundation in the setup package, but you're also involved in recent legislation statewide. Talk about House Bill 47 and what that does for Ohioans.
Yeah, House Bill 47, I'm very proud to have been a part of a group to help push that initiative forward. House Bill 47, what it does is that it requires that all schools, local and private, and recreational facilities, that they are now required to have automatic external defibrillators on site. But it's not enough just to have the resources. You also need to know what to do. So coupled with that, with House Bill 47, you are also required to have emergency preparedness plans so that people know exactly what to do in case of an emergency, and more specifically with sudden cardiac arrest. And then to bring it all together, House Bill 47 also requires that all staff and coaches, that they know how to perform CPR and they know how to effectively use an AED, which we think will help to save a tremendous amount of lives.
So beyond learning CPR and how to use an AED machine, you're involved in a whole range of things in the community, whether it's a football camp or a coat giveaway or online or in-person event. How have you been able to form so many fruitful community partnerships and branch the mission out so widely?
Yeah, so we've been blessed with the opportunity to leverage a platform that my son has been given, playing for the National Football League, and also coupling that with the fact that we are here, from Cleveland, Ohio. This is our hometown, and so we are, just very happy to be able to give back in a lot of creative ways. And so that's one of the things that we try to do, is that we try to align the events that we bring forth with heart health. I'm bringing heart health awareness, more specifically teaching people how to do CPR, how to use an AED. But we know just saying come out to this event to learn CPR and use an AED sometimes is not the most attractive. So what we try to do is we try to meet people where they are and come up with creative approaches as to how we implement the events that we have to draw the crowd to come out into the community. And while having fun doing the things that people like to do, we also incorporate the mission and the message of the importance of heart health awareness.
You've received a variety of awards over the years, from 100 Black Men, that organization, and a whole range of others. How does it make you feel to know that the work you've been doing for nearly 9 years has had such an impact on our local community?
Yeah, it feels great to be recognized, but honestly, like starting this foundation and doing this work as far as bringing awareness to heart health and learning how to do CPR, teaching people how to do CPR and using AED was truly not for awards and accolades. So to be recognized was really a sweet surprise. I'm very appreciative and very humbled by the recognitions that our foundation has received as a result of the work that we're doing in Cleveland.
You've turned a personal tragedy into a life-saving mission. How has this changed you personally to have had this impact?
As a result of losing someone that you are very close to, or losing a loved one, sometimes it can give you a new perspective on life, a new appreciation for life. And that's what it's done for me. And I think that's what it's also done for our family. And so to be able to, take the pain and tragedy that we have faced in order to bring hope and hopefully, lives saved to other families, it means a lot. And it has just, again, has changed our outlook on life and our approach completely.
Well, I'm personally inspired by your story, and I think a lot of our viewers will be as well. Thank you so much for joining us.
Thank you.
Coming up next, we continue diving into the realities of heart health with a cardiologist from University Hospitals who shares critical advice on protecting your heart. You'll also hear from the director of aging from the city of Cleveland. Plus, an incredible medical breakthrough, a patient who defied the odds, finding his way back from heart attacks to full health. His survival story will inspire you. Don't miss it, right here on TV20's Cleveland Health.
Hello, I'm Scott Osicki, Chief Executive Officer of the Alcohol, Drug Addiction, and Mental Health Services Board of Cuyahoga County. We know that life can be overwhelming, but you don't have to face it alone. If you or someone you know is feeling anxious, depressed, in a mental health crisis, have alcohol or other drug use concerns, or just need someone to talk to, help is available. Call or text 988, the Suicide and Crisis Lifeline. It's free, confidential, and available every day 24/7. Trained and caring counselors are there to listen, support, and help you find hope no matter what you're going through. Remember, you're not alone. Call or text 988 anytime because your mental health matters, and so do you.
Hello, I'm Michelle Princeton, and I'm a licensed social worker working for the Social Support Service Unit out of the Mayor's Office of Prevention Intervention Opportunities for Youth and Young Adults. The City of Cleveland has demonstrated a long-term commitment to residents working to create safe spaces in our neighborhood resource and recreation centers where families can access free resources and support services. We are committed to working together with families and other community providers to identify and help families who are struggling to achieve a better quality of life. To access the social support services, leave a message at 216-664-2223 and a team member will return your call. Our work includes referring individuals to appropriate services such as medical, hospital-related, long-term counseling, public assistance, veterans benefits, Social Security, Medicare, Medicaid, food stamps, housing assistance, Head Start, and student loans. We also provide support and guidance for youth and young adults in addressing stigmatization, scapegoating, labeling, bullying, substance abuse, and unhealthy relationships. Once again, to access social support services, leave a message at 216-664-2223 and a team member will return your call. Thank you.
Welcome back. Today we're talking about a topic that affects millions of older adults, heart health. Did you know that heart disease remains the leading cause of death for seniors in the United States? Let's take a closer look at the numbers. High blood pressure is a major risk factor affecting nearly 70% of adults aged 65 and older. If left unchecked, it can lead to heart attacks, strokes, and other serious complications. About 60% of senior citizens have high cholesterol, which doubles their risk of heart disease. Heart failure impacts 6.2 million Americans. This condition means the heart isn't pumping as well as it should, leading to fatigue, shortness of breath, and fluid buildup. Physical inactivity increases heart disease risk by 50%. A daily walk can make a big difference. Diabetes increases heart disease risk 2 to 4 times in seniors. If you or a loved one has diabetes, managing blood sugar levels is essential to protecting heart health. Heart disease is often preventable. Simple steps, such as eating healthy, staying active, and keeping up with medical checkups can help senior citizens live longer, healthier lives. We're now joined by Mary McNamara. She's Director of Aging for the City of Cleveland. Welcome, Mary. It's good to have you.
Good to be here, Richard.
So just how prevalent is heart disease among seniors, and what are some of the biggest risk factors that you can identify?
Heart disease is very common among older adults. As expected, our heart ages with us, and the majority of older adults are on at least one heart medication. And studies show that more than 70% of older adults have some sort of heart disease. So some of the most common risk factors for heart disease include smoking as a risk factor, obesity, physical inactivity, high blood pressure. Those are some of the most common.
What type of resources does the City of Cleveland have in its arsenal to help seniors avoid cardiovascular disease?
Well, I think the first most important thing that I want to let viewers know is having a health home is most important. You know, having a doctor that you trust, that is accessible to you. So, you know, there are some smaller clinics in the neighborhood. Obviously, we've got our big health systems. But I think a key source for older adults to know about is that the Department of Aging can help with transportation to get to these health homes. So that's a barrier we hear from older adults is, you know, how do I get to the medical provider? And so I want people to know about Senior Transportation Connection. It's a free service for Cleveland residents.
Are there any other barriers that seniors face in accessing health care in terms of their heart, whether it's, you mentioned transportation, but screenings and other services?
I think a key thing, sometimes people don't know what their Medicare benefit covers. And so that is a resource we provide at the Department of Aging, is helping to navigate your Medicare plans and knowing what wellness benefits are available. There's also a great resource at the state level called the Ohio Senior Health Insurance Information Program. And that also helps people understand what benefits and choices are out there for your Medicare plan, which is what most older adults are on, Medicare.
Does the Department of Aging have any programs whereby they promote healthy living for seniors and give them tips and tricks on how to stay good?
I'm so glad you asked that. One of our favorite partnerships in the community is with our resource and recreation centers. The city has more than 20 recreation centers, nearly in every neighborhood. So in the far west side, there's the Gunning Recreation Center. In the north side of Cleveland, Collinwood Recreation Center, Zelma George, Frederick Douglass, I could go on and on. But each of these centers are free and have a robust range of exercise options for older adults. So as easy as chair exercises to full treadmills, tracks, weight rooms. So I really want to encourage people to think of those centers as places they can attend, participate. We welcome their participation. And then I can't help but plug our senior walks. Every Wednesday, year-round, the Department of Aging pops up at one of our recreation centers or a park. We want you to walk with us at the pace you can, potentially maybe increasing each week with the safety and support of others around.
And more broadly, what other services does the Department of Aging offer seniors that they just might not know about, whether it's related to heart health or other health issues?
Yeah, Richard, our tagline is we're here to help. And we're really a front door to what's called our aging network in our community. So I want viewers to know that there are more than 20 senior centers in our community. These are places that offer a daily meal. So if you need that resource, call us and we'll connect you to what's in your neighborhood. Or perhaps you need a home delivered meal. We know that one of the ways that we can make our heart stronger is by eating a well-balanced diet filled with fresh fruits and vegetables. So we want to connect you to those senior centers, home delivered meals. We also want to connect you to the Greater Cleveland Food Bank. So we're a phone call away. Our phone is answered 45 hours a week, 8 a.m. to 5 p.m. Call us and we'll connect you to any range of services, either that the city offers through the Department of Aging or in our larger community.
Any new initiatives that seniors should be aware of that are taking place within your department?
Well, one of our most common requests, Richard, is for people want to be able to age in their home as long as possible. The average housing stock in Cleveland is 105 years old. Home repair programs, call us because they're always changing. New ones that come available, we want to connect you to the one you want that matches your needs so you can age in your home.
Mary, thank you very much for joining us and sharing such valuable information.
Thanks for having me.
Coming up next on TV 20, could you imagine living without a pulse? Well, that's exactly what Kenny Wagner did. After the break, we'll bring you an incredible story of survival that you won't want to miss. Stay with us.
At Cleveland Rape Crisis Center, we believe that everyone deserves to feel safe, supported, and heard. For over 50 years, we have been here to help survivors of rape, sexual abuse, and human trafficking rebuild their lives and to prevent future violence through education and advocacy. Our services are confidential and always free of charge. We provide 24/7 crisis and support hotline for immediate help, individual and group counseling to promote healing, specialized services for children and families, advocacy and legal support to navigate complex systems, prevention education to empower communities, resources and support for deaf and hard of hearing survivors through our Deaf Pathways program, and drop-in center for the on-spot assistance. No matter what you're going through, you are not alone. Call our 24/7 hotline at 216-619-6192 or text 216-619-6192 or visit clevelandrapecrisis.org to chat with a trained professional. Help is here and healing is possible. Together, we can make a difference.
We continue to share important stories and educational insight on heart health awareness. Now let's hear from Kenny Wagner, a survivor of a widowmaker heart attack, as he reflects on his experience. We'll also hear from Dr. Thomas O'Neill. He's a cardiologist at University Hospital's Harrington Heart and Vascular Institute. He's going to discuss warning signs of heart attacks and offer up advice on how to live a healthier life. In 2013, Kenny Wagner contracted a severe case of food poisoning, which led to complications including ulcerative colitis and eventually the removal of his colon. His health continued to deteriorate over the following years, and then, in September 2016, he suffered a life-threatening heart attack, triggered by a blood clot.
I don't know, my husband, he had major surgeries and now he just fell and he's not breathing.
During the emergency, his wife Susie performed CPR while calling 911, helping to keep him alive until paramedics arrived. Then in 2021, Kenny faced yet another heart crisis, prompting doctors to implant a left ventricular assist device into his heart to support its function.
So an LVAD is called a left ventricular assist device. It's connected to the left side of your heart. It goes 6,500 revolutions a minute. Cord comes out your stomach, connects to a control unit. And by day, you have batteries that fit in the pouches of these shirts that my wife had made for me. And at night, you connect up to an extension cord where you can go about 30 feet.
What Kenny was experiencing is known as a widowmaker heart attack. It's a term used to describe a severe blockage in the left anterior descending artery, which supplies a significant portion of blood to the heart. Dr. Thomas O'Neill, a cardiologist at University Hospital's Harrington Heart and Vascular Institute, explains that this type of heart attack is especially dangerous.
So a heart attack, or the also known as a myocardial infarction, is a blockage in the arteries or the coronary arteries that supply the heart with blood. There are three primary arteries that give the heart its blood, and the largest one of those is the left anterior descending artery that runs down the front of the heart. When a blockage forms in that large artery, then it's sometimes colloquially called a widowmaker.
Dr. O'Neill says that there are several warning signs of a heart attack that people should never ignore. He stresses the importance of recognizing these warning signs early and seeking immediate medical intervention that can significantly improve outcomes and even save lives.
So most people are aware that the most common, or at least most commonly known side of a heart attack sign is a heart chest pressure, chest pain, but really it can be almost anything, an uncomfortable feeling anywhere above the waist. So that can include nausea, breaking out into a cold sweat, neck pain, arm pain, shortness of breath. Any of those things should trigger a possibility that could be a heart attack.
There are several proactive steps you can take to reduce the risk of heart attack and maintain a healthy heart. Dr. O'Neill emphasizes that both lifestyle choices and family history can impact heart health.
So the most important thing is to sort of know your risk factor profile. So things like family history, diabetes, high blood pressure, high cholesterol, those can be, you can't treat those until you know about them. So first of all, you have to see your doctor and have the very basic tests to sort of figure out if those things are relevant to you. There's lifestyle things, eating healthy, exercising, maintaining a healthy weight. But for many people, there's a genetic factor that we just can't overcome with eating healthy alone, and that's when medicines are important.
For survivor Kenny, he puts his trust in physicians like Dr. O'Neill, whose expertise has played a crucial role in his recovery. He is deeply grateful for the unwavering support of his family, who stood by him throughout his health struggles. Kenny also acknowledges the generosity of his donor's family, whose selfless decision gave him a second chance at life. He carries a profound sense of appreciation for the medical advancements and the people who make his survival possible.
I think about the donor's family every day. I don't think that enough emphasis is put on the caregivers that go through any type of situation like this. So every day I'm very grateful my wife was there for me every single day. There's a lot of patients out there that don't have any family members. I had tremendous support, not only from the staff, but my family and friends and thousands of people from the 3 different places I lived.
Kenny is committed to giving back to the community by raising awareness about heart health and supporting others facing similar medical challenges. He hopes to share his story in order to encourage people to prioritize their heart health and seek medical care when needed. Through advocacy, fundraising, or even mentorship, he aims to make a meaningful impact on those in need of life-saving heart health care.
I also have an idea to start a nonprofit, and you have to get a biopsy every single week once you get a transplant. So I was thinking about maybe opening up a nonprofit and have like an adult Ronald McDonald House, so people 40 miles away or more didn't have to worry about driving 3 hours. They could stay. It'd be staffed, maybe staffed, maybe not. We're still working on it, but somewhere they could stay.
That's it for today's edition of Cleveland Health. We hope you learned something that could help you or a loved one live a healthier life. I'm your host, Richard Stewart. Thank you for joining us.